Thank you, sir, for the nice backdrop for the subject. One of the things which I thought I should present is the model which I'm seeing in one of the projects executed by K2 Technology Solutions as an interesting model for the PPP. If you look at the PPP models, our chairman has elaborated a lot on this, where we have very limited risk at the top, where a private party will design, build, but it is financed by the public enterprise, or the full risk transfer where we have a concession agreement where 100% responsibility is with the private enterprise. In choosing a model for PPP, I think a proper risk profile for all stakeholders have to be considered, and we also need to consider the differences in sectors like roads and infrastructure, human resource management, or healthcare. I believe that when we talk about healthcare, these are much different from the other PPP projects which we see normally, which are more and more successful, particularly in the road infrastructure sense. And if you look at the Indian healthcare, I believe with my experience, there is a boost needed for the primary healthcare. And some of the goals, the Millennium Development Goals, can be addressed very well if we try to address the primary healthcare in a better way. And hence, conventional PPP with high risk for private may not be suitable for the healthcare sector. And this is where we need to have a balance of what needs to be done by the private and the public, and how we need to do the model. In Bihar, we are executing a project for the statewide telemedicine network, starting from the low-level, block-level PHCs, primary health centers, to the district hospitals, and then to a state command center where we have experts available. The concept there, which was, I think, an innovative concept, was to design, build, but not owned by the private sector. It is owned by the public sector, and we, private sector, operate and maintain. So from a design, build, own, operate, transfer, we are moving into a different kind of PPP model where design, build, but not own. So we get money for whatever infrastructure we set up. The second thing is we earn revenues through user fees, where we charge very affordable prices to the patients. And this user fee is shared between private and the public enterprises. This helps in, I think, recovering some of the maintenance costs, which can make it more and more sustainable. And this project is primarily focused on primary healthcare. So all facilities which are required for primary healthcare are provided by this model. Just a glimpse of the architecture. We have 212 PHCs connected to 38 district hospitals, connected to a state level unit. Everything is networked well. We've had challenges in doing this network in the villages because when we are in cities like Hyderabad, Bangalore, Delhi, we assume a lot of things, and these lot of things are not available in those villages, and hence I thought it is a good point to make. This is the system which we have implemented there. It is a unified healthcare management system as a kiosk in the PHC. We have already implemented around 100 PHCs connected to 19 district hospitals. Medical tests and consultations done at affordable prices. Consultations by doctors online at the civil hospitals, or the Sadar hospitals as they are called in Bihar. And we provide services to rural patients. Currently we are getting around 15 patients per day per kiosk, which is low. If you consider having a full risk PPP model, the private party would never have earned any money out of whatever investment he has done. So I think that model of funding the infrastructure but getting it operated by a private party is a different model. According to me, the factors for effective PPP model for Indian healthcare are these. One, it has to be a win-win-win situation. It has to be a win for a citizen at large, win for public enterprise, government agencies, and win for private enterprises. There should be affordable and easily accessible services, and onus is on proper implementation with an eye on continuing cost control. Many of our PPP projects fail because people concentrate on implementing once and then everything goes out of control, including the costs. And another point which our chairman talked about nicely was nurturing relationships. And we have seen in the PPP models, relationships don't go far. We need to have a continued relationship model or continued partnership model where the private party will work with the public enterprise for good of the citizen at large. That's all I have. Thank you.